My name is Ed Martinez. I am the Associate Program Director for the Pediatric Critical Care Fellowship.
Girish Deshpande. I'm a pediatric intensivist, professor of clinical pediatrics.
Hi, my name is John Gelbach. I am the Fellowship Director for Pediatric Critical Care Medicine.
The Pediatric Critical Care Fellowship, it's a 3-year fellowship. Those that do their general pediatric residency go on to specialize in pediatric critical care.
The majority of our fellows' time is spent with the medical ICU team, although they spend, I think, 5 blocks of time with the cardiac surgical ICU team over the course of the 3-year program.
Fellows not only get general bread and butter pediatric critical care, but they also see a lot of other subspecialties.
So your first year is pretty heavy clinical, but as we progress throughout the year, we really start to focus on learning the academic side and learning and getting a research project undergoing.
Typical days on service involve rounds in the morning, following an afternoon of didactics, following up on patient needs that developed on rounds, seeing new admissions, doing procedures, those types of things.
We've set the program up nicely. We have a great curriculum. We have intensivists who are eager and willing to teach. So really, you show up, you put the work in, and I think you're going to come out of here a great intensivist. The great thing about doing your fellowship and training here in Peoria is we're the only children's hospital for Central Illinois.
The center was recognized as a Center of Excellence by ELSO, which is the organization for extracorporeal life support.
Most of our fellows rotations take place in the pediatric ICU. We have a mixed unit model, which means we have within the same physical space a medical ICU team or medical surgical ICU team and a pediatric cardiac surgical ICU team.
We have 9 faculties, and they are all involved actively in fellowship education. We have a lot of clinical research opportunities based on the number of patients that we get and the variety of patients that we get.
Healthcare workers are really very well respected and looked up upon from the community, and really drives in a sense of pride for being able to support their community the way we do in providing care for critically ill children. We see a wide-ranging variety of pathologies here at the Children's Hospital of Illinois, particularly in the pediatric ICU.
In about close to 39-40 counties, so we have significant pathologies that we get to see here.
We get to see and do everything. That includes your bread and butter pediatric ICU. So your respiratory, your TBIs, and then your cardiac, your single ventricle, VSDs, repairs. So the range of things that we get to take care of is quite extensive.
We definitely see a fair share of run-of-the-mill pathologies like bronchiolitis, asthma, diabetic ketoacidosis, but also are a major referral center for the central part of the state, in which case we see very odd and unusual diagnoses.
Life in Peoria is, to me, is wonderful.
Peoria itself is a great place to call home. It's a great place to do some training from a medical standpoint.
I think that's what I appreciate about Peoria the best, because of how down to earth and how warm everybody was, including here at the hospital.
At the same time, for people that are hungry for that big city environment, major cities like Chicago, St. Louis, Indianapolis are all a short drive away. And
I can travel to both Chicago and St. Louis and take day trips. My wife and I, we do that all the time.
It's a relatively small-sized city, which means the cost of living is fantastic, better than any place I've lived, and traffic is almost non-existent.
Is less than 20 minutes. If you are driving for more than 20 minutes in Peoria, you are either lost or you are traveling outside Peoria.